Ibuprofen is one of the most popular over-the-counter medications for pain and inflammation. But what's actually happening inside your body when you take it? Let's break it down. When you get injured, sick, or experience stress in the body, your immune system reacts by sending out chemical messengers called prostaglandins. These signals trigger swelling, redness, pain, and heat, the classic signs of inflammation. It's your body's way of healing and defending itself. But sometimes, inflammation goes too far, causing pain and discomfort that gets in the way of recovery. That's where ibuprofen comes in. Ibuprofen is a type of non-steroidal anti-inflammatory drugs. It works by blocking an enzyme called COX, short for cyclooxygenase. This enzyme helps produce prostaglandins. So by inhibiting this enzyme, ibuprofen reduces the number of prostaglandins, which in turn reduces inflammation, pain, and fever. Unlike paracetamol, which mainly works in the brain, ibuprofen works throughout the body. That's why it's often recommended for inflammatory pain, like joint swelling, muscle injuries, menstrual cramps, or even dental pain. It starts working within 30 to 60 minutes and lasts about 6 hours. But it can irritate the stomach lining, so it's best taken with food and avoided in people with ulcers or certain heart conditions. In short, ibuprofen calms your body's overactive immune response, dialing down the inflammation and helping you feel better, faster. If you found this helpful, hit subscribe for more medical animations.